Terahertz. Terahertz is defined as a form of radiation between the microwave and the infrared spectrum. Okay? So if you're into numbers, these are the kind of numbers that you look for. This is the frequency. So what is it used for? It's used primarily in telecommunication, where they exceed microwave. Any of you have 5G phones? If you have, 5G phone use microwaves. And 6G use terahertz. Okay? They are also ideal for detecting substances. Okay? You know that you want to detect substance, you use X-rays, you use all kinds of scans. So terahertz can be used for that. Almost every molecule has a fingerprint spectrum on terahertz. So this is something I will touch on at least a few times in this talk, so that you know what it is. So this is where terahertz is. On this side you have radio waves, very long wavelength. Then microwave, as I say, this is 5G, and this is where you use to heat up your food. The reason why you can do so is because it's able to agitate the water molecules until the temperature goes up. Then this is infrared. If you use DVD players, if you use very advanced one, you use a fiber optic cable. Or if you go to the doctor, they do a scope. They have fiber optic scopes. What is the ray that passes through the fiber optic? Do you know? It's infrared. So we've used this, but this wasn't used for quite a while. So the breakthrough came in the 1990s when there were new techniques developed both to generate and to detect terahertz waves. So 2011 there was a breakthrough. There's a 1771 painting where they were able to show that beneath the surface layer there was another picture. They were able to detect the paintbrush. They were also able to detect the signature, the original signature of the painting, which cannot be seen if you just look at the painting. So it can actually penetrate. So before this there was what is known as a terahertz gap. And what is this gap? It is here. This part we were using electronics to study radio waves, and then telecommunications we start to advance. Then on this side we're studying it as light, and we study visible light, and of course infrared has been around for a long time and we use it. There's infrared saunas, infrared blankets, infrared all kinds of things which appear to have health benefits. Okay, so terahertz is again. Do you follow here to study as electronics, or do you study here to study as in photonics? And if you are aware of the news, you know that in China they are looking at photonic chips. The trade war between US and China. They are looking at using carbon, they are using photonic chips, which is basically light rather than this kind of waves. So these are some of the things that are being looked at and researched into, and I think it's very exciting times to be able to do all these things. So what does it mean for us? Well, let's look at the application. As I said, the chief application is in telecommunications, where 5G is microwave and 6G is terahertz. And you can see from the picture beforehand why it is so. It's able to kind of be more penetrating. Of course, the distance is shorter. You will realize that 5G base stations are nearer than the 3 or 4G, which is further apart. So 6G will be closer still. And for military and security, because it can look through things, screen through things. So it is very useful in immigration to look at what you have. But they say that it is so powerful that it can penetrate so many things that people are protesting. They say human rights. We have a right to be private about certain things. So, well, that's the West. So it's used in agriculture, where they use it to monitor various things such as drought monitoring, pesticide, seed, and soil monitoring. And of course, in health sciences, we find that it's useful because it's non-ionizing. X-rays, you know, too much of it can damage your cells, but this doesn't do it. And also we realize it resonates at cellular frequencies. I will touch on this thing later on. So terahertz is known as the light of life. So how does the healing properties of terahertz come about? From two important things. One, it gives heat. It is also known as far infrared, as distinct from the other infrared, which are known as near infrared. So you know infrared makes you warm. The sun has plenty of infrared. That's why we get most of our infrared. If you go to a campfire, if you start a bonfire, you have a lot of infrared coming to you. And of course, there are nowadays infrared saunas. If any of you go to saunas, you would have heard of this. So it gives warmth and heat, and it also gives vibration. For me, this is the more important part, that it gives vibration, because a lot of things now has to do with vibration. A lot of medical applications has to do with vibration. And vibrational medicine is now very much in vogue. So, in the application of terahertz in medical devices, there are those that use for diagnostic devices. As you know, terahertz can see through. So you can see through various layers in the bone, for example. They are also used for therapy devices. In fact, that's how I got interested in terahertz during the pandemic. There was a double-blind study done in the US where they look at near infrared, which is slightly shorter than far infrared, and they use it to clear the lungs of COVID-19 patients. And was very impressive. In fact, after a number of clinical trials, it was approved for use in COVID-19. Now that is very useful, because then you can have technicians rather than doctors to help patients. Okay, so terahertz is far infrared, and it seems to me logical that far infrared will have this effect also, and indeed it has. A lot of people with COVID-19 have used it quite marvelously. So, what is the property that makes terahertz so useful for the purpose of helping people to cure themselves? Well, it is non-ionizing. It doesn't harm you. Secondly, it penetrates everything: wood, paper, textile, plastic, ceramics, everything. But it's absorbed by polar compounds. A polar compound is a conductor of electricity. So it's absorbed by water. Water conducts electricity. It's absorbed by metals. Anything that can conduct electricity will absorb it. And it's absorbed differently by various biological tissues. You know, your body is 70% water. So, but different tissue have different concentration of water. So as a result, it is absorbed different to varying degrees, and depend on how much you absorb, it will have a signature. So, if it can be absorbed by polar compounds, it must have energy. Yes, terahertz is energy. In fact, the ability to have this frequency tells you that it is energy. And this energy corresponds to what in chemistry we call hydrogen bonds. In other words, two hydrogen came together. It is not a bond like in sodium chloride or common salt, where the bond is very strong. So the bonds in van der Waals forces are very weak bonds between hydrogen atoms. For example, if you have drink terahertz water or alkaline water or something of this sort, you would have known that somehow this water seems to be better. And that's because if you look at water, if you try and pour a glass of water away, you think you pour it away, by putting it upright, you find that there's still water there. So this water did not get poured out because of the attraction of water molecules for one another. They form the surface tension. Right? So because of this van der Waals forces push the hydrogen atoms together, the water molecules tend to be together in clusters. In other words, different molecules get bound to one another. So that's why, in a sense, water is thicker. Now, when you break these forces by using terahertz waves to break the bonds between the hydrogen atoms, the van der Waals forces we call it, the water becomes disconnected, so it becomes more penetrative. They slide over one another, right? So it can penetrate better into tissues and so forth. And terahertz in the body can change the shape of your molecules. And we're not talking of simple molecules, we're talking of complex organic molecules such as protein, carbohydrates, and so forth. Molecules which are folded. If you see a protein molecule, it's actually a three-dimensional thing. It's folded in many directions, held together by hydrogen bonds and van der Waals forces. So terahertz can change the shape by breaking these bonds. And normal human cells resonate at the same frequency. This is an amazing thing, that everything vibrates. You know that, right? Even a table vibrates, even a bridge vibrates. That's why when you march over a bridge, you break up the steps. You don't want the frequency to go inside, and then the bridge can collapse. It has happened. So, and of course, a singer can sing and the glass can crack. So everything has a frequency, and if you resonate at the same frequency, things happen. And so it is used to regulate biological systems because of these properties by changing the interaction of various molecules in the body. Okay? So let's have a look at the effects on the body. Well, first of all, it opens up blood vessels. It dilate, open up, and vibrating molecules, water molecules become activated. And mitochondria are the very tiny factories inside your cell, which are the ones that produce your energy and manufacture things. Okay? So, but besides activation, when the cell is hyperactive, as in inflammation, when the cells are very active, it can calm them down. And then it has an effect on DNA. It actually unzips DNA. I'll show you a picture of this later. So one, it opens up blood vessels. As you know, the blood comes from the heart. This is from the heart. As it gets smaller and smaller, it gets into the vein. As it gets here, this is the surrounding tissue. Water and other things leave the blood vessel to supply the various cells that need them. Okay? And so this is the fluid in the organs, in the cells, in the tissues. And as it leaves, other things has to be disposed of, right? Your waste products, your carbon dioxide, all this will enter the veins. Okay? Now, this is not very efficient. You will know why. Because this one came directly from the heart, right? The heart pumps it, right? It's under pressure. So this thing happen easily. But this thing, there's no pump. So it comes in very slowly. So there will be excess water, excess waste products in the tissue, and these have to be drained. So they are lymphatic tissues, lymphatic channels, lymphatic ducts, which drain the excess water and the waste products and return it to the heart. So that's how the circulation comes about. Okay? So the other thing is regulate inflammation response. As I said just now, when there's inflammation, the inflammatory cells get activated, and then a lot of inflammation gets poured into the bloodstream. Terahertz has this ability to calm reduce the inflammation response, and that's very helpful. It activates normal cell. This is a stylized human cell. In these various boxes are the various types of function that a cell can have. So some of the function: biosynthesis of iron and sulfur, transport of metabolites, energy metabolism pathway. You eat a lot of food, get metabolized and convert to energy, and your energy is known as ATP. So the more ATP you can generate, the more active you are. So it can destroy cells that are no longer needed, they are broken up and destroyed. And this causes the death of cells, signaling, so forth. Different cell function all happen in the mitochondria. Okay? Because the death of cells who have gone past their lifespan, you know, one cell in your body is about 60 days, right? And when the days are up, the cells that are kind of have lived its lifespan send chemical messengers which essentially signals that find me and eat me. So they're engulfed by other cells called lysosome, phagosome, and so that, and ingested. That's how the body clears itself of dead cells. Okay. So after 2 to 3 months, you're a completely new person. All the cells that make up you 2-3 months ago have all been replaced. Okay, you have a new you every 3 to 6 months. So if you get old, it's because this is not very effective. So toxins accumulate and things don't work as usual. That's what we call aging. The other thing you can do, it can kill bacteria, viruses, fungus, and things like that. So all these microorganisms can kill. So as I say, in COVID-19, it's a virus, right? It can kill the COVID-19 virus. So I myself have a fungal infection of the skin because of the hot weather. So do many people in Singapore, and it can be effective in killing the fungus. Okay, so DNA, as you know, is in 2 strands. Terahertz wave has the ability to unzip the DNA. Why do you want to unzip? Well, when a DNA, which is 2 strands, when the 2 strands are together, nothing can happen. It is dormant. It is not active. You unzip them for 2 purposes. One purpose is when you want to multiply. So you're going to duplicate the strands, right? You will create another strand. So you're going to unzip them so that you can read the molecules, which molecule is it, and enzyme will find a suitable molecule which corresponds to that and manufacture the next strand. The other thing is when you want to use it, so for example, the protein has instructions how to make a protein. Okay, so you get the RNA, which basically read it, and then the RNA serves like a printer to instruct the mitochondria to print another protein molecule. So that's why the DNA has to be unzipped. So it's a very interesting phenomena, isn't it, that cell biology can do that, and this is a very important function of Terahertz. So today we cover endocrine glands. These are all the endocrine glands in our body. Do you recognize any of them, or is it completely new to you? So you have the pineal gland, which I will talk about, which is pituitary, thyroid, thymus, adrenal, pancreas, ovary, intestines. Pituitary, you have the anterior, you have the posterior, and then they secrete hormones that regulate other endocrine glands. Okay? So Pancreas, probably you know, pancreas secretes insulin, isn't it? People know this. Huh? So we'll talk about this today. You all heard of the words, what we eat enable us to go, to be active, to grow, to increase in size, or to develop, to have new tissue to replace the old ones, and to glow. You look good, isn't it? So today we're going to look at hormones that help you to grow to be what you are. But first, let me explain what are endocrine glands. There are two kinds of glands in the body, endocrine and exocrine. Endocrine, as the word endo tells you, it secretes the hormones directly in the bloodstream. Exocrine secrete them into ducts. Okay? Now this is a very important distinction. This is a picture of endocrine glands. The cells, these are the capillaries. It secrete into the duct, into the bloodstream, and it goes into the blood. Exocrine gland secrete into ducts, which are then drained. You all know pancreas have insulin, right? But do you know what is the main function of the pancreas? Any of you? Pancreas produce a lot of your gastric juices for your intestines. Those that digest your carbohydrates, your fats, and your protein. So these digestive juices are secreted into ducts, which go into the pancreatic duct, which then join the bile duct and go straight into the small intestines. So it can break up all the fats, proteins, carbohydrates that you've eaten. You have a wonderful meal, you feel good. So all your enzymes have the job of breaking down into simpler products that you can absorb. Now, besides producing all these enzymes to break down your food, the pancreas also has certain cells called the Isle of Langerhans. Isle of Langerhans are the cells that produce your insulin. And Isle of Langerhans are endocrine cells. In other words, insulin is not produced and then secreted into ducts and then go to some place, like your digestive juices. Insulin is produced and delivered directly into the bloodstream. So it affects your blood sugar level. So that is the difference between endocrine and exocrine glands. Today we talk mostly about, or almost about endocrine glands. So this is a list of some of the diseases I will cover today. I will not cover stress hormones because stress hormones are in a group of the goal performance hormones that allow you to perform. It's very complex, so it requires, I think, at least one, if not 3 or 4 lectures, in my opinion. Then there are enzymes to do with beauty, which is the sex hormones, okay? And that again require a whole lot of lectures because it's not an easy topic to cover. So we'll cover the rest. And the other thing I want to say is that I won't cover tumors of the endocrine organs. Every endocrine organ can go haywire and can give you a cancer. Okay? For example, when I talk about the pancreas, you can get a pancreatic cancer. And because the pancreas is hidden right inside, you won't know until it grows quite big, isn't it? So, of course, unless you're an alcoholic, you're not so much at risk for pancreatic cancers. So I will not cover cancers of the endocrine organs because too much to cover. I'm not able to do it. So let's start off by talking about nitric oxide. If you have attended my previous lecture or looked at the videos of previous lecture, you would have heard me say something about nitric oxide. It's a very powerful chemical. In fact, it is now recognized that this is everywhere in the body. It is also highly reactive. It's so reactive, it's called reactive oxygen species, or ROS for short. ROS is an oxidant. When you take antioxidants, the antioxidants attack the ROS. Right? So ROS are chunks of bits of molecule which are very reactive because of oxygen or because of nitrogen. So you have reactive oxygen species, you also have reactive nitrogen species. You combine nitrogen and oxygen together. What do you expect? We could get two powerful atoms together and put them together. They're even more powerful, super powerful, right? So the straight line here illustrates the site where they interact with other compounds. You see? In fact, it's so highly reactive that if you don't control it properly, it can cause so much damage. Destroy energy metabolism, damage DNA, it can lead to cell dying. Extremely powerful. And yet, the body can use it and make it function as antioxidant. See how amazing, how brilliant God or whatever you believe in is able to use this simple molecule to do things. So, the thing about this is that nitric oxide is often produced near the site of activity. For example, in the heart, where you need the heart sometimes to open up to have more blood flowing through, it's produced very near the site of action. Or in sexual organs, like penis or the clitoris, it's produced very near the site of action. So it acts, open up the vessels, and then immediately it is destroyed. It's very transient. So in the past, people can't catch it because of the fast action and very short lifespan. But it's been studied. Why? Well, one of the reasons is because nitric oxide's terahertz fingerprint has been identified. The terahertz wave that it emitted has been identified, and you can, by that you can tell it is nitric oxide. So as a result, we know that it's everywhere in the body. It's produced everywhere in the body, and as I say, it's used as an antioxidant, open up blood vessels, smooth muscles, regulate the activity of your mitochondria, which is the factory in the cell. So one thing we know, that because its signature, its terahertz signature has been identified. In other words, it vibrates at a certain terahertz frequency. So terahertz stimulation produces NO. And that's why terahertz make you alive. So this vessel, one of the important function of nitric oxide is to open up the blood vessel. From this to this is open up. And that's due to the action of nitric oxide. So really, nitric oxide is like a hormone, isn't it? It's secreted into the bloodstream, utilized, and then destroyed. You open up the blood vessel, it prevents your platelets from getting together. Platelets cause clotting. So sometimes you don't want it to happen because you don't want all your blood vessels to jam up, isn't it? Of course, if you have a wound, you want it to clot. But inside the body, you don't want your platelets to get together and cause a clot. That's what happens when you have a heart attack or a stroke. Your platelets got together and jam up, so blood can't go through, oxygen can't go through. Your heart or your brain, deprive oxygen, dies off. That's what a stroke or a heart attack is all about. So it prevents smooth muscle from multiplying and moving to other spots, especially when you need the smooth muscles to act. Okay? And it's able to cause mature cells to die off, to Apoptosis means that the cell commits suicide, kill itself or asks other cells to consume it. And it maintains the integrity of the cell membrane inside your body. Now that's terribly important. You don't want your cell membrane to leak, because once it leaks, it serves no purpose. Everything leaks everywhere, then you'll be bleeding all over the place. So these are the functions of nitric oxide. So what happens when things go wrong? Well, things can happen if your diet is poor, or you don't exercise, or due to aging. I'm sure you have seen the Popeye the Sailor Man. What does he take? Spinach. Spinach is high in nitrates. And when you take spinach, you have plenty of supply of nitric oxide. Meat, a lot of substance, meat, eggs, things like that contain a lot of nitrates. Protein, in fact, has a lot of nitrogen. So you can supply you with nitric oxide. Lack of exercise also, you may have loss of calcium, loss of whatever. You don't exercise, you don't use it. Whatever you eat is not utilized. Only your urine become very rich, because all the good things are not utilized. So when nitric oxide is low, wound healing is affected, and you don't have the strength. You walk a little bit, I want to rest, that kind of thing. And it appears, we don't know whether it's the cause or the effect, in Alzheimer's, old age, Parkinson's, Huntington's. We don't have Huntington's here, it's more common in the West. Amyotrophic lateral sclerosis or ALS, strokes. All these conditions have very low NO. Maybe that's why things disintegrate and they can't maintain themselves. Alright? So when nitric oxide is not present, it's not able to regulate the cell death. So you have a lot of toxic substances accumulating, because once a cell is no longer functional, whatever they have becomes toxic, isn't it? Waste products, right? And of course, blocks normal respiration. You must know that in the lungs there are plenty of nitric oxide. So if you have not enough nitric oxide, you can't breathe properly. So to me, this is an important hormone. And the fact that it has a terahertz signature, so that it resonates at the same frequency as terahertz waves, which means that when you use your terahertz wands, it easily activates the nitric oxide inside your body. Okay? Next we talk about the thyroid. And I'm sure you probably have seen somebody with hyperthyroid. You know what that is?
Goiter. Goiter.
Goiter, that's right. That's the name for it, common name for it. Excessive thyroid hormone. Excessive thyroxine in the circulation. Usually females, you do see in males, but rarely. It's an excessive production of thyroid hormones, and typically bulging eyes. The eyes bulge out. Enlarged gland. You can see, that's why it's called the goiter. And the symptoms include anxiety, tremor of the hand, highly irritable. They can't tolerate heat. They sweat, the skin is moist, and although they eat a lot, they still lose weight. So it's paradoxical. There's a lot of tightness, and they have frequent bowel movements, and as the sexual organs in the female, menstrual irregularity, and in the male there is erectile dysfunction. So this is hypothyroidism. Big bulging eyes, goiter here, That's what it is, enlarged thyroid. Hot flushes, weight loss, unintentional because you eat a lot to gain weight and then it happens. Insomnia, heart rate, anxiety, diarrhea, bulging eye, reduced libido, appetite. But the bones also get affected. The bones can thin out, tremor, muscle weakness. Okay? So this is a hyperthyroid for you. What are the causes? Graves' disease is an autoimmune disease. It can be due to thyroiditis, which is the inflammation of the thyroid. And you may be taking thyroid hormone for whatever reason. If you eat too much, yes, you can get hyperthyroid. And of course, it can be due to tumors. So these are the main cause. The chief cause is Graves' disease. Mostly, that's what we see. Occasionally, we see this. Rarely, we see some people been taking thyroid for some reason or other. They take too much. So hyperthyroid is highly treatable. And in some cases, it can go away. But we have anti-thyroid medication, which you can take to reduce the activity. You can use radioactive iodine. You know that iodine is part of the thyroid hormone, right? And one way to get rid of low thyroid is to take iodine. Surgery, you can remove that. Acupuncture works. Amazing. And Terahertz radiation works. Within 30 minutes, there's a trial on this in the literature. So this actually works for Terahertz. Hypothyroid. Hypo means low. Low levels of thyroid hormone. Trouble tolerating cold temperature. They feel very cold. They feel tired, weight gain, joint muscle pain, dry skin, thinning hair, irregular menses, fertility problems, slow heart rate, and they're usually depressed. Then, this is dangerous. Myxedema, coma. When everything slowed down until crisis point, when your heart rate slow, or when you're so cold that you are at danger of hypothermia. So this is a crisis. This is a serious thing about hypothyroidism. So hypothyroid is like that. It's still enlarged. Why? It's a reaction. Low thyroid, they try to enlarge to produce more. And of course, if the cause cannot be reversed, it will end up being enlarged. So these are the signs of low thyroid: poor memory, concentration, poor hearing, hoarseness, slow heart rate, delay reflex, everything is slow, coldness, shortness of breath, weight gain, poor appetite, hair loss, constipation, tingling sensation, menorrhagia, there's bleeding in the reproductive system. So this is hypothyroidism. What are the causes? Congenital. Some people are born with it. Either the thyroid is not formed or somehow it is not there. Hashimoto's is an autoimmune disease. Again, you can have a thyroiditis, which is inflammation. Sometimes you start off with hyperthyroid, you treat it too aggressively, it goes the other side, hypothyroid. It can be caused by medication, things like lithium or amiodarone can cause it. It can be a complication of other diseases, diabetes. We don't see celiac disease in the tropics, rheumatoid arthritis, and so forth. So most of the time is an autoimmune condition. So how do you deal with it? Well, replace the iodine. Iodine will help you to synthesize your thyroxine. So Diets rich in iodine includes eggs, meat, dairy products, seafood, edible seaweed, iodized salt. You can also give the replacement hormone, L or levothyroxine. You treat the primary cause. If there's a tumor, remove it. Autoimmune causes, try to regulate it. And I, as explained to you just now, for autoimmune diseases, terahertz is quite powerful in regulating the autoimmune disease. And the thing is, as much as possible, you try to get it normal so that you avoid the complications of hypothyroid, which include heart problems, mental health issues, obesity, bone problems, joints, and so forth. Primary, there is no cause, can be lifelong. So it can last throughout life. Not many, but you can see them from time to time. So terahertz has this ability to activate and regenerate thyroid function, of course assuming there's thyroid tissue there. If you are born without thyroid tissue, then it's a bit difficult, because it's not possible to activate something that isn't there. So that's hypothyroid. Let's move on. Pituitary gland. Pituitary gland is a gland at the base of the skull, above your nose, around there. There are two lobes. There's an anterior lobe which produces 4 trophic hormones. Trophic hormones, I explained to you just now, are hormones that regulate other endocrine glands. And what do they regulate? They regulate your sex hormones, your thyroxine, and your cortical hormones. We'll talk about thyroxine, we'll talk about cortical hormones later on. It also produces growth hormone. And growth hormone influence your height, your bones, and your muscles. See? So, growth hormone fluctuates depending on your activity level. Hormone level rise in childhood, it peaks about puberty, and then thereafter it comes down a bit. In adults, growth hormone is necessary to maintain normal body structure. Okay, so without growth hormone, you have quite a bit of a problem. So in adults, it boosts protein production, fat utilization. So if you raise fat utilization, your blood sugar will go up. That's what happened. Blood sugar, and it interferes with insulin. Well, 20, 30 years ago, there's a craze to want to use growth hormone because they see that it boosts protein production, it maintains normal body structure. So if you use growth hormone, maybe you can reverse the effect of aging. People take it for its anti-aging effect. So people were taking growth hormone. They were squirting things under the tongue and things like that. Is there any truth to that? We'll find out. So this is your nasal cavity. This is what is known as a sphenoid bone, and this is the pituitary gland is here. Okay, the anterior, the posterior part. This cavity is called the part of the sphenoid bone called the sella turcica. So the hormones produced are all here. Let's look at the posterior first. The posterior lobe or the pituitary produce oxytocin and vasopressin. Oxytocin regulates the breast and the uterus, as well as oxytocin now is known as the hormone of bonding. When you fell in love, this is a hormone operating. Vasopressin has to do with the kidneys. When it's secreted, it prevents the water from being passed out as urine. So that's the function. So anterior produce more hormones. It produces growth hormone, affects the bone, muscles, and organs. It affects prolactin, which has to do with breastfeeding, production of milk. But prolactin has other function as well. And it produces trophic hormones, which controls the sex organs, adrenal cortex, I will talk about this, and thyroid, which we mentioned just now. So, very small gland, plenty of hormones secreted. Growth hormone disorders. In childhood, deficiency leads to dwarfism, small size, small build. Overactivity leads to gigantism, huge size, tall. Growth hormone abnormalities. In adults, slightly different. If you have excessive growth hormone production, you don't get taller anymore. Your height is dependent on the bone, what they call the epiphysis, which is kind of solidified. So you can't grow taller, but what happens, the growth hormone makes your hands, your feet, and your face very coarse. So I'm sure you've seen some people, right? Their hands, their legs, their feet rather, and the face very coarse, and that's the result of excessive growth hormone. So that's the effect of excessive growth hormone. If it's a deficiency in adults, it leads to your muscle mass being reduced, you can't tolerate exercise, increased fat, and a lower quality of life. The funny thing about growth hormone is that both high and low growth hormone leads to increased mortality. So it's a balance, isn't it? So you can consume more growth hormone, there is no anti-aging effect. In fact, your life gets shorter if you take more.
But then how does it affect the cell growth, in terms of apoptosis of the cells?
What?
The growth hormone, if you take the growth hormone, LGH.
If you don't have, yes, you can replace it. That's replacement.
Yeah. You supplement it.
Yeah.
But if you have too much...
Can you ask the question afterwards, unless it's relevant?
The question was, will it affect, the cell death, apoptosis of the cells? For instance, the cells grow, and if you take LGH, you keep on growing, creating into a tumor.
No, until puberty is reached.
Yeah.
Then after that, you don't grow. You just maintain your body mass and so forth. Maintain your body function.
Okay.
People are trying to take extra in the past to increase their mortality for anti-aging effects. It's not true. It doesn't happen that way. So, one way to regulate the optimum GH level is with terahertz, infrared saunas to kind of regulate it. Adrenal. Adrenal is a very interesting organ. Adrenal glands produce steroidal hormones. They're called steroidal hormones because they are made from cholesterol. All the hormones produced by the adrenal, the shape of the molecule is based on cholesterol molecule. Okay? So they include adrenaline, noradrenaline. In the US they call it epinephrine and norepinephrine. Means the same thing. Nephrin means kidney. Renal means kidney. So it's so called because it's on top of the kidney. It produces cortisol, which is a stress hormone and also regulate glucose metabolism. And aldosterone, which is the hormone for conserving sodium. And sex hormones in small amounts. The adrenal is very unique. Everybody's adrenal produces both male and female sex hormones. It's very important. So the female will have some male sex hormones, and it has its function in the physiological functioning of the female. Similarly, in the male, they also have female sex hormones produced in the adrenal, and they help in the proper functioning of the body. It's something quite unique. So that's where the adrenal is, on top of the kidney, cap like that. A very small gland. But don't think it's a small gland. There are actually 3 layers in the adrenal. There's a medulla, there's a center, there are 3 different zones. And different zone produce different hormones. So some of the hormones they produce, aldosterone, which affects the kidney, cortisol, glucose and stress, epinephrine, and the sex hormones. I will cover this only. I will not cover this. This for another lecture because too much to talk about. Adrenaline or noradrenaline, they are the hormones in response to stress. We call them the fight or flight hormone. You heard of the word fight or flight? You either run away or you stand to fight whatever that stresses you. Adrenaline rush. When something provokes you, there's usually a spurt of adrenaline produced. We call that an adrenaline rush. If you jump from a height, you see, you parasailing or whatever it is you do, you jump. So that things cause an adrenaline rush, and that rush can last for 30 minutes up to an hour. Noradrenaline has another function. It helps you to focus attention. I shall talk about that when I talk about the performance hormones. Low levels of noradrenaline and high levels lead to inattention. Again, like growth hormone. When you try to focus, you find that if you are not aroused, just wake up, you can't focus. Then when you're awake, when enough noradrenaline is in your body, you can focus. But if you're too stressed, you have too much noradrenaline, you can't focus again. So again, it's about balance. Okay? So that's why they say you want to be really, really productive, you need a balance of hormones. Just the right amount, not too much, not too little. If you have too low levels of adrenaline and noradrenaline, you have physical and mental problems. So anxiety, depression, low blood pressure, low heart rate, low blood sugar, migraine, headaches, insomnia, and all these things. And adrenaline can cause you tiredness, inability to concentrate, attention deficit, and depression. So low adrenaline and all this can be caused by medication, such as Ritalin used for ADHD, stress, inadequate diet, really enough. And as you can see, a lot of this has to do with lifestyle. So if you have low levels, you are kind of that inactive, not motivated kind of a person, you look at your lifestyle causes. Look at that and remedy it, and you can get things moving. High levels, how about that? Excessive production of adrenaline or noradrenaline, usually caused by excessive stress. So if you're always under stress, you have excessive amount of it. If you're obese also, you need to carry that big load with you. It can also stress the body. And tumors, of course. So when you're too high adrenaline, excessive sweating, irregular fast heartbeat, high blood pressure, you become jittery, there's a trembling, headaches, your hands are cold and clammy, and there's a risk of damage to your heart and kidneys, and your brain as well, and your eyes as well, if you have high blood pressure. So again, the thing to do is you look at your lifestyle causes, whether it's excessive stress or obesity or whatever. So Terahertz is able to make you relax. We know that. In one of my earlier talks, I mentioned about that. So with high levels, use terahertz to help you to regulate the stress. So this is a stress response. Stress response starts in the pituitary. This is ACTH, the corticotropic hormone. It's called adrenocortical because this is the adrenal gland. Cortical is a cortex, one part of the adrenal tropic hormone which regulates adrenaline and all that. Adrenaline and cortisol, they go into the bloodstream, and that's where all the results of stress is, right? So in response to sudden onset of stress, you have this adrenaline rush, right? And these are some things you need to know. Open up your pupils to improve your vision, you can see clearly. Decrease sensitivity to pain. Rapid effects, few minutes to an hour. Increase heart rate, blood flow, and alertness. Prime you for action, isn't it? That's what the stress response is. And adrenaline and non-adrenaline are stress hormones, as well as cortisol to some extent. Aldosterone is classified as a mineralocorticoid. A corticoid is a steroid hormone derived from cholesterol. It's called mineral because it affects sodium. So basically, aldosterone is involved in sodium and water conservation. So sodium is conserved, potassium is excreted. ADH, I mentioned just now, right? Regulates water balance. In other words, when ADH is produced, water is retained, you pass less urine. When you drink a lot of water, ADH is not produced, so you have a lot of water pass out. So the release of both these hormones is stimulated by low blood pressure. When you have low blood pressure, the body retains sodium, retains water to bring up your blood volume. And high aldosterone can be caused by a tumor. Low aldosterone is caused by Addison's disease. And Addison's disease is known as a primary adrenal insufficiency. It causes acidosis because high potassium level, low sodium. And this can be threatening. Addison's disease. Let's learn a little bit more. Again, you notice that a lot of endocrine problems are really autoimmune disease, isn't it? In other words, your body attacks your own organ. So why is it autoimmune? It's caused by repeated infections. For example, TB, HIV, fungus, bleeding in adrenal or secondary cancer spread. In other words, all these attacks, all these insults cause the adrenal to fold up and it can't function properly. And often you detect the disease by chance when your sodium is found to be very low and your potassium found to be very high. And of course the test will confirm the result. So usually Addison's disease, you find that the aldosterone and the cortisol is low. There's no cure. It's compatible with long life. But the thing is, it can cause what is known as an Addison's crisis, which again is an emergency. So what are the symptoms? Tiredness, irritability, depression. You crave for salt. You lost appetite, lost weight, low blood sugar, low blood pressure, fainting spells, nausea, diarrhea, abdominal pain, muscle joint pain, irritability, depression. So what is an Addison's crisis? Any of these things. Aggravated can cause confusion, reduced consciousness and weakness. You see? And this crisis is usually brought on by something happening to you, a stress due to infection, due to illness or something happened, and your body just cannot cope because the hormones are not there to support you. See, these endocrine hormones enable you to live and to be what you are, to do what you need to do. So when the hormones aren't there, you can't cope with stress, you can't cope with illness, you can't cope with infection. Essentially, that's what Addison's disease is all about. So, Addison's disease. Low blood sugar, bronze pigmentation, change distribution, gut disturbances, diarrhea, vomiting, weight loss, weakness, and so forth. Adrenal crisis, profound fatigue, tiredness, dehydration, vascular collapse, low blood pressure, your kidney shut down. So these are all the bruising and pigmentation you see in Addison's diseases. Okay. Cortisol. Cortisol is a very important hormone. You probably hear it when you go for stress talks and you talk about cortisol. But cortisol is more than a stress hormone. It regulates glucose metabolism. How does it regulate glucose metabolism? It stimulates fat and carbohydrate metabolism, so you have a craving for food. Cortisol makes you want to eat. And it maintains the blood sugar in your blood. It kind of inhibits inflammation, especially when it's very high level. Now there's something about cortisol. There's a variation. When you're asleep, cortisol is very low. When you wake up, cortisol starts to be pumped into your blood and it gets higher. Then, as it goes into the late afternoon, your cortisol level drops. And that's where people start to feel drowsy. So you have people taking power naps or whatever. In some countries, they have the siesta, right? In Spain. In China, I find that my cousin, he goes to work and then he comes back for lunch and he goes to sleep because work in the afternoon doesn't start until 3 o'clock. They allow you 2-3 hours of rest. So this is in line with the variation of cortisol level, because cortisol makes you active, makes your blood sugar level up so you can active. Cortisol helps you to endure and cope with stress, infections, or the demands of life, put it that way. Okay? So that's what it is. When you don't need it at night, it comes down again. Yeah? So I like you to think of it, this variation. So when you're stressed, there's a demand on you, right? That's why it's high. When you're alive and you need to do things, it's up. When you donate, it is down. That is cortisol for you. Cushing's disease, usually due to some gland, some tumor in the benign tumor in the pituitary gland. It produces excessive ACTH, so the thing is disrupted. And Cushing has a typical feature, very rounder face, obese, and your arms and legs are like sticks like that. So you have a block of plasticine sticking your arms and legs. That's how it looks like. Usually adults 20 to 50 years. The disease is fatal if untreated. You don't survive average about 4 to 5 years, that kind of thing. So that's Cushing's disease. But there's something called Cushing's syndrome. Cushing's disease is one type of Cushing's syndrome. 70% of Cushing's syndrome due to pituitary benign tumor. Other causes include you take too much cortisol. Who will take too much cortisol? Cortisol is given in the form of prednisone tablets used to suppress your inflammation. So autoimmune diseases like lupus, you take cortisol. If you have organ transplant, you could suppress the inflammation response, you take cortisol. And particularly in the case of organ transplant, you need to suppress the inflammation so that there's no organ rejection, right? So you have to take it, and in this case, you may end up having a Cushing syndrome, excessive cortisol. But Cushing syndrome is not very common, 10 to 15 cases per million, and if you can know where the tumor is, you want to remove it. There are oral medication, long-acting injection available. You may treat it, but you still have medical problems because you suppress inflammation, so you kind of destroy the balance. It can also be caused by stress, because stress brings out the cortisol, so it can cause this. And one way to deal with it, traditionally infrared saunas, which is basically the same as using Terahertz. So instead of going to infrared sauna, might as well use Terahertz. It's the same effect. So that's what it looks like. Obese, stretch marks, hum in the back, stick like the bone, paining, bruising. So long-term use of cortisol, tumor elsewhere. Basically that's it. As far as Cushing syndrome, you see such a person, you can easily recognize it because of the moon face, the hum, the stretch marks, the bruising, the stick-like arms and legs sticking out. Pineal gland, melatonin. You all heard this? You have.
Yeah.
What is it used for?
For sleeping.
For sleeping.
That's small dose, but high dose is anti-cancer.
Yeah, they're not supposed to use high doses, but there's a much bigger story to it, and which you will hear now. It's known as a sleep hormone. Like nitric oxide, it has a specific terahertz signature, identified. So, like nitric oxide, melatonin is one of the few substances identified that has a terahertz signature. In other words, it vibrates at the same frequency as terahertz. There is a melatonin cortisol diurnal variation, day and night cycle. You hear me say just now cortisol, right? Daytime it goes up and then it comes down. Melatonin is just a reverse. It goes down in the day, at night it goes up to help you to sleep. So, melatonin is produced where? In the pineal gland, right? No. It is synthesized all over the body in all cells, especially in your stomach, in your brain, in your liver, bone marrow. It appears to alternate with dopamine. Dopamine is the feel-good hormone. People praise you if you enjoy something, or even if you take drugs, you get dopamine. Make you feel good. Serotonin is a happiness hormone. So these hormones are produced in the day, melatonin in the night. These are the hormones that makes you go. And melatonin is a very powerful antioxidant. It scavenges ROS. You know what's ROS now, right?
Yeah.
Huh? Let's compare it with vitamin C. If vitamin C can get rid of one ROS, how many ROS will melatonin get rid of? Any of you? Guess any number? Guess? Huh? Any number?
1 million times?
Huh?
1 million?
10 times.
10 times.
10 times more powerful than vitamin C. It's a very powerful antioxidant. In fact, it's been estimated that the pineal gland produces less than 5% of the total melatonin in your body. It's amazing, isn't it? So let's learn a little bit. First, that's this diagram. This melatonin. Your pituitary gland is somewhere here, right? Huh? And there's a bone here, isn't it? The nasal cavity. So this. The important thing about the pineal gland is it's outside of the brain, you know. It's not in the brain. The brain is enclosed in a capsule called the blood-brain barrier. So your pineal gland is outside the blood-brain barrier. So it's technically outside of the brain. So melatonin in the pineal gland, as you age, it produces less. So that's why maybe old folks has a problem sleeping. And depression is also associated with low level of melatonin. In fact, there's an antidepressant that is shaped like melatonin. And so this antidepressant is shaped like melatonin because there are some melatonin receptors that appear to mediate depression. And reduced melatonin is seen in some illnesses like Parkinson's, Alzheimer's, and things like that. Melatonin is able to restart insulin in some cases of diabetes. And the thing is, they found that acting as an antioxidant, melatonin can actually cause cancer cells to stop multiplying and spreading. In fact, so powerful it is that in the West they classify it as a prescription drug. You need to get a prescription and get melatonin. In Singapore, you can go to the pharmacy and buy it. And now I see they have 3 mg, 10 mg available. So let me talk about this further. As I say, melatonin is a very powerful antioxidant, right? So it is produced all over your body. So after a heavy meal, you feel very sleepy, right? Now it has been found after a heavy meal, your body produce, your intestines produce melatonin, and some of this melatonin filter into the bloodstream and affects you, so you feel sleepy. So besides the cortisol variation, it dips after lunch, it's this effect of melatonin. No wonder people sleep very well after a heavy meal. But the other thing is also, it is produced inside the cell near the mitochondria. And scientists have identified receptors inside the cell that is activated by melatonin. So possibly, you know, the mitochondria produces a lot of activities, right? Energy and things like that. A lot of these ROS are produced, and melatonin has the effect of inactivating this ROS. In fact, it is said to be one of the most powerful antioxidants inside your body. In fact, the thought occurred to me, if NO, nitric oxide, and melatonin both have Terahertz signature, both activated by terahertz, and there's a lot of evidence for it. Could it be that a lot of the effect of your terahertz radiation is due to these two, nitric oxide and melatonin? It could well be, because the melatonin that is produced inside every cell of your body, right? That is produced all day long, whether it's daytime or nighttime, it's still produced because it is used as an antioxidant. You see, it's not used to induce sleep. See, so this very interesting fact tells you something, that a lot of the function in your body is regulated in a very complex manner by your body system. So it's a matter of balance, right? You see the balance in all the hormones that we talk about. Too much, no good. Too little, no good. You need to find balance. So when you make lifestyle choices, it has also to be like this. You want to be healthy, you want to be healthy. You want to maintain good habits, positive outlook. That's not to say a negative outlook is useless. No, it has its use. If you go to Iraq, you go to a place where it's unsafe, you want to have your negative outlook to protect you, right? So it serves a function, but we want balance to enjoy life, to live life. We need to be positive about things that you should be positive about, so that in times of danger you can be negative appropriately. You see, that's why we have stress. At the appropriate time you need to fight. At the appropriate time you need to fly, to run away. But at appropriate times you need to reduce the stress so that you can enjoy, to laugh. You need to spend time with yourself. And yet we know that one of the indicators of whether you will live long life or not is not how much loved ones you have, but it's how connected you are with people. It's what they call social network. How many people do you say hi to in a day? If in a day you can say hi to a lot of people, that seems to predict how long you live. Whether you go out, to the hawker center, you go to your club, your church, your temple, whatever. You connect with people. Say hi, smile. So that's what it is. Life is about balance. Life is about go, grow, and glow. Have a happy, healthy life. Be serious. Make sure there's lots of fun and laughter as well. That's why the title of my book is Conquering Stress, Make It Fun. I tell the story, at the end of the book, I tell the story of this guy this lady rather, who was in prison for 2 years or something. So very short during 2 years. So she was carrying a long face and brooding and being nasty to everybody. Then she met another lady, happy, cheerful, just drawn to this world. So why you're so cheerful? How long is the sentence here? My sentence? 6 years. I still have 3 or 4 years more to go. She's surprised. So long now. In 2 years I've been so miserable. How come you can be so happy when yours is so long? And she said, well, if I'm so miserable like you, I can't last that long. To last that long, I need to be happy. That's why I titled my book, Conquering Stress, Make It Fun. How do you make yourself happy? You see? So, in essence, when you talk about the endocrine system, it's about that balance. You see? see, not too much, not too little. And I like this lecture. I've been wanting to give this, but because the topic is so huge, it was kind of I need to look at it and organize it in such a way that I can talk about some and others I talk at a later lecture. So, Terahertz to repair, regenerate, make you look and feel young. Recently, an old friend meet me and hey, you look younger. I said, is it? So I said, well, I practice anti-aging. I go to the gym. I do things that make me able to tolerate life. You see? And so, you can look and feel young. No matter what your age is. Age is no longer a number. Age is what you are doing, what you enjoy. That's all. So, come back, your iTerahertz, useful for inflammation, pains, blockages, skin. So, you should use it for all this. And what you shouldn't use it for? Pregnant, acute diseases, object implants, people with congenital heart, open wound infection. Now this one, there's a lot of evidence against this, I must say. Because in the literature I discovered that there have been several research papers on wound healing. How using Terahertz can improve your ability or your wound to heal better. So yes, you can use Terahertz for wound healing. The rest, take note of it.
Now, excuse me, about the heart disease.
Okay, I'm about to finish. Can you hold on to your question?
Okay,
Then you can ask it.
Yeah.
So thank you. This is what is known as a bioresonance scan. So if you are healthy, like me, most of the time no major illness, how do you know where to scan? You know where to scan by using a bioresonance scan, which can tell you which part of your body may not be functioning properly, and you can scan that part. I've scanned for a number of people and I've detected problems in the colon, for example, problems of gallbladder, problems of the hip joint or the shoulder joint. So this tells you where you can target your scanning, right? And I can give you a generous discount for that. Just let me know. I also do other things. I have my books there. I have my online courses there. These are some of the things I do. So if you find this talk useful, support me by buying my books or use me for some services or other, so that you will encourage me to give you good value. Okay? So now I'm ready for questions.